these waiting lists have only been rising and rising and rising. It's not the result of strike action that's causing that. It's not the result of junior doctors causing that. It's because of a lack of funding of our health service, a lack of staffing of our health service. And if more and more doctors leave and choose to go to other countries, it's only going to get worse.
I'm here for patient care. I went into medicine, being a doctor, to look after people and to look after them at their time of need, when they most need someone, not only someone to treat their heart attack or to put a piece of metal in one of the valves around their heart to sort out the problem, but to hold their hand and to give them the care that they deserve. And it's absolutely disheartening to see that the way that things have to be because of the current situation, and that's post-pandemic. And we do have a lot of recovering to do from that, but this is more than that. It's been going on longer than the pandemic. This is a longer term issue than that, and there has to be some recognition from the government, because at the moment it just feels incredibly disrespectful about what we do.
We've got 7.2 million patients on waiting lists at the moment. This is more than the population of Scotland. So it's a huge number. At the moment, we aren't operating a health service. We're operating a waiting list. Patients are dying waiting for care. We know that 500 patients are dying at the moment, every single week waiting for care. And you see that every single day when you're in hospital working. So I'll go in not knowing whether there's going to be someone else on the shift with me, whether I'm going to be doing more work than one doctor should be. And what you see in hospitals is doctors running from patient to patient, trying to stabilise them, putting out fires opposed to being able to give the best care. And this leads to worse outcomes for patients. And I think patients are really suffering here. And I urge Mr. Barclay to come to the table, give us an opening offer so we can negotiate and come to a solution.
So I know I've worked night shifts, even most recently, where we've had a couple of people down and being unable to get more staff in at late notice, so we've had to do extra jobs of other people. Now it seems that a lot of our jobs, even day jobs, we're missing staff on the wards just because of a lack of recruitment, a lack of training, and that really puts a lot more pressure and burnout on all of us.
And then what does that mean for patients?
So that means that, say, if you have a ward where there's 30 patients and you should have 4 doctors, if you only have 2 doctors on that day, you're doing twice the amount of work. That's twice the amount of things that you have to do, possibly twice the amount of errors that you might make, in which you shouldn't be doing. So you shouldn't be working in a system that's unsafe. And that's what we really want. We want a safe system. We want to be paid for what we're worth and paid at a level that's appropriate for the job we do.
Things are really busy. We have seen that we've come back from COVID and we've worked really hard to try to kind of make up for all the losses that we did, but things are still pretty dire, to be honest.
So at medical school, we're taught to give the best patient care possible. We're taught what the gold standard is. And the reason that we all go into the profession is because we want to help patients. Unfortunately, we aren't able to do that anymore because there just isn't enough of us. We've seen that actually in December alone, 50,000 patients waited longer than 12 hours to be seen by a hospital doctor. This is a disgrace. Patients are waiting in hospitals in pain, in agony, worried about what their condition is and how they're going to be treated. And the fact that they're waiting longer than 12 hours is unimaginable. And it would have been unimaginable back in 2008 when we were the best healthcare system in the entire world.
Well, if we look back, let's say look back to 2008, where people weren't working as hard in terms of the workload's gone up much more. We're working effectively 1/4 of our job less in that time, but we're not worth 1/4 less, as it were. And things are only getting harder since the pandemic. We've had a lot more work. We've had people leaving our profession, going to other countries, and that's just made the whole system worse.
My rota line has rota gaps, and we're often asked to fill locum gaps due to the staff shortages that we've seen, and that's mainly due to doctors leaving medicine. So I have friends that move to Australia and New Zealand for better working conditions and for better pay. I've also got friends who are leaving medicine altogether because there's hope elsewhere. Why would they stay in a profession where they're not being recognised, they're not being respected, and they're not being paid for what we do?
Do you worry that the UK could lose a lot of talent to countries like Australia?
I've seen it. So I've had colleagues in the last couple of years that have left to Australia, and it seems that with the recent increase in inflation, with more pressures that people have, a lot more people are leaving, and that's what I'm really worried about. So I mentioned that there are gaps in rotas, that sometimes people aren't there to fill shifts, and that's only going to get worse.
The reason that junior doctors are on strike this week is because our pay has fallen 26% in the last 15 years. What this has led to is a workforce crisis. So we've seen that we're 9,000 doctors short in the UK. and this has led to rota gaps everywhere. So you go to work, you don't know whether your rota is going to be fully staffed, you don't know if you're going to have any help on the shift, and you don't know whether you're going to have to do the job of more than one doctor whilst you're there.
Do you think there's unfair pressure put on medical professionals to fulfil a rota gap, perhaps that there might not be in other businesses?
Yeah, I think so, definitely. I mean, I think it comes from a place of altruism. You know, the reason I went into medicine is to try to help people, and it's disheartening and heartbreaking to see that people are left without the care that they need. And unfortunately, that's what happens when we have staff shortages, and that's what we see day to day. I've worked in many departments, on many wards, where I've seen that patient care has been compromised, and we see it day to day. Obviously, in the strikes, there's been concern that there will be disruption, and that things have been cancelled, and that's been brought up again and again, by people who are concerned. But we see disruption on a day-to-day level. Clinics are being cancelled, operating lists are being cancelled, and we can't provide the care that we want to because of the way that things are.
Do you think that Rishi Sunak or Stephen Barclay would survive a day on one of your wards?
I would love them to come and do the job of a junior doctor, not just for one day, not for one shift, but for, say, a whole month, and really understand what is involved and the sacrifices you have to make for your family, the hard work you have to put in, and the suffering that you often see as part of the job.
I'm really, really sorry to every single patient whose appointment has been cancelled. This is unnecessary. It shouldn't have happened, and the reason it's happened is because the government refused to negotiate with us. So our dispute has been going on for over 6 months now. Before we had our industrial action, our first set in March, and before we had our ballot, we were constantly writing to the government and the Department of Health and Social Care, stating what our concerns were, and since then, we've met with Mr. Barclay twice. The first time he didn't have a mandate to talk about pay, and the second time he refused to give us an initial offer. We can't negotiate with someone who won't give us an offer. Our problem at the moment is we don't have a appointment or a. At the moment, we don't have a meeting in the books to discuss our pay or conditions with Mr. Barclay, and we don't see a way out without taking industrial action, and that's why there's 50,000 of us out here today.
Do you think you have time to process the emotional toil that comes with medicine?
I'd like to think I'm getting better, but I think it comes by being able to set boundaries, and those boundaries are really hard to set if we're not able to have the leave that we need, the support we need when we're at work, and if we're always being asked to fill rota gaps, or if I'm always turning up to a ward and there's a doctor short, then I'm always going to be having to work that little bit extra, and then I'm just getting rid of the bank of reserves that I have.
So we've got 7.2 million patients on waiting lists at the moment. This is more than the population of Scotland. So it's a huge number. At the moment, we aren't operating a health service. We're operating a waiting list. Patients are dying waiting for care.
These waiting lists have only been rising and rising and rising. It's not the result of strike action that's causing that. It's not the result of junior doctors causing that. It's because of a lack of funding of our health service, a lack of staffing of our health service. And if more and more doctors leave and choose to go to other countries, it's only going to get worse.
We know that 500 patients are dying at the moment every single week waiting for care. And you see that every single day when you're in hospital working. So I'll go in not knowing whether there's going to be someone else on the shift with me, whether I'm going to be doing more work than one doctor should be. And what you see in hospitals is doctors running from patient to patient, trying to stabilise them, putting out fires opposed to being able to give the best care. And this leads to worse outcomes for patients. And I think patients are really suffering here. And I urge Mr. Barclay to come to the table, give us an opening offer so we can negotiate and come to a solution.
Do you think by delaying ending the negotiations, the government are showing that they don't care about patient safety?
Well, I think that it's a huge problem that they need to address, because every single week that they're letting this dispute go on and ignoring the core problem, which is the fact that we don't have enough doctors, we are seeing patients die. And that is in their gift to end this dispute, give us pay restoration so we can retain and recruit doctors and solve the problem that we have, which is the waiting list and patients not being seen in time. Death is a huge problem, and I think the government aren't wise to ignore that.